Welcome. I am here, Dr. Nancy, to talk you through Texas Pharmacy Law Preparatory Course. This is a 2-week series to prepare you for your pharmacy law exams or help you refresh your memory on Texas pharmacy law. This course is designed for pharmacists, pharmacy interns, grad interns, or anyone who needs to understand the scope, the breadth and width of pharmacy law in Texas. Now, pharmacy law exam is bigger than just an exam, right? It allows you to practice safely, confidently, legally, and independently in Texas within your scope of practice, of course, as a pharmacist, depending on your practice setting as well. So, years ago, decades ago, when I graduated, most of us just couldn't wait to get it over and done with. It was like, let's just, this is a course that we took maybe over one semester, and now we're tested on it. Can't wait to just memorize and get out of the way. A couple of decades later, and with many other licenses obtained, I can tell you that pharmacy law governs your daily practice, your daily authority as a pharmacist. So understanding, retaining some of the information as you prepare is paramount. Now, how does understanding pharmacy law govern your career or help shape your career? Understanding information will help you protect your license. You'll understand the prescribing authority under whatever protocol that your state has, or state of Texas. Immunization authority, for an example, decreases your risk exposure, right? You can make informed decisions. You understand documentation standards. You decrease proactively inspection risk. So first is, when an inspector walks in, your heart doesn't automatically sink. Why? Because proactively, you have been practicing in accordance to rules and regulations that govern your practice. And then employment security. They pull up your license and there are no infractions or anything listed under your name, then the knowledge of law, rules and regulation has done its work, right? And then you can, of course, protect your professional reputation. So let's look at law as a risk prevention step that we have to take in order to practice effectively. Understanding rules and regulations that govern Texas will help you protect your employer, sometimes from themselves, right? Because many times we as pharmacists find ourselves in situations where we don't think is backed by the laws of the state, but we're not sure, or we don't take the time to look up, right? So now, as you prepare for Texas State, if there's anything that comes up, an initiative or operational changes that are in opposition to what you read or the current laws of Texas, you can just go there and pull up that information directly and forward it to the person in authority. So you protect yourself, you protect the employer. You're able to practice safely. If you're a supervisor or find yourself as a pharmacist in charge or manager, you understand the breadth and width of your scope. And so you practice effectively. And then all these lead to license protection. So what are some of the daily decisions? Where do we see law in practice? Irrespective of the setting that you end up in, law is seen in every shift, every prescription, every verification. It's not just state law, it's not just Texas law, it's also understanding the federal laws, right? So some of the questions we ask ourselves daily that we don't really, in our brains, differentiate whether is this a clinical thing or is this law? When we practice, right? Or things like, can this prescription be transferred? The patient is demanding everything transferred. Within the state of Texas, can those prescriptions, control, non-control, scheduled, non-scheduled, can they be transferred? How long is a Schedule 2 prescription valid for? When is a partial fill allowed? And this can be with regards to controlled substances, most likely, because the rules there are stricter, and we'll get into that a bit later. What documentation is required for emergency fills? Who can sign for controlled substances? What must be reported to Texas PMP? When must the pharmacist be physically present in the pharmacy? And what are technician ratios? These are some of the questions that we think about daily, weekly, every shift that are law-related questions, operational questions as well. So law is not theoretical. It is something that happens every time that you're in the pharmacy. How does law change by practice settings? So the information that you practice with daily hinges on your practice site. And so here we'll look at a few practice sites or a few scenarios where you find yourself working. We'll look at community practice, which is really the front line of law, because not only are you dealing with prescribers on one side, business owners on one side, and then the patients on another side. So you need to understand dynamics and how to navigate any situation that will come up. Hospital practice, compounding, and mail order pharmacies are other examples that we will look at briefly during this introduction. So let's take a look at community retail pharmacy. What are some of the daily legal exposures? Controlled substance dispensing rules is one we deal with. PMP checks, when not to, is there a time? Emergency refills, who authorizes them? Early refill red flags. So when is it a red flag when a patient comes for refills? Is it after the first, second, third? What does that also indicate? And of course, this particular highlighted topic has both law and clinical implications. Partial fills, transfer limitations, immunization authorization, collaborative practice agreement. So in our daily practice, on our daily shifts, we are faced with different aspects of pharmacy law. And so understanding this information is key to practicing confidently. Now, community law focuses on what counts as a valid prescription, when documentation must be immediate, when a verbal order is allowed, and what constitutes of corresponding responsibilities, right, as a frontline application of law. This is just some of the things that we face daily, weekly in community practice sites. We look at hospital or institutional practice sites, we're looking at a little bit of different legal dynamics, right? But all this information we still have to know for pharmacy law exam. So we look at floor stocks rules. What medications can be stored on the floor in a hospital? Who makes that list? It's important to know. And then who has access to the floor stocks? Emergency kit access. Who has access there? And of course, what can be in the emergency kit? Beyond use dating for compounded medications or open insulin vials, multi-dose vials. Automated dispensing cabinets. Who can refill them? Who has access to them? Order authentication timelines. If someone, let's say, goes into automated dispensing cabinet because the doctor's put in an order and nurse goes in there and takes it out, what is the timeline for the pharmacist to review that order? Medication reconciliation documentation. How do we document medication reconciliation when the patient is admitted, when the patient is discharged? And compounding authority. Who can compound? What can they compound? Are there any restrictions then? Right? And of course, there are more things, but these are just some of the instances where law rears its head and where we need to understand what's going on in general. Now, irrespective of what practice site you're choosing to go to upon graduation or change in jobs, if you're taking the MPJE, you need to have a clear understanding of all of the practice sites, including nuclear pharmacy. Any kind of pharmacy that we have in Texas, you must have full knowledge of how you can practice there safely, legally. Now, hospital compliance focuses on pharmacist review, right? When is pharmacist review required? Who can access controlled substances? What makes a medication order legal? Or what makes it valid? And what documentation protects the institution? So in the hospital setting, course patient safety is number one, right? But at the end of the day, everything that you're doing is going to be told as a story when it comes in terms of accreditations and audit readiness, right? So you always want to, in every practice site, be audit ready, and it's beyond the scope of MPJE, but this is where policies and procedures, which are actually hinged on the rules and regulations, are the things that have you audit ready. So once again, understanding the rules and regulations will prepare you not just for the exams, but for a successful practice. All right, so let's look at compounding, sterile and non-sterile compounding pharmacies. Here, the laws that regulate the practice will focus on USP standards, personnel training and documentation, environmental monitoring, record retention. Now, these are not exclusive to compounding and compounding pharmacies, because we know that these same things happen in institutional settings, and some pharmacies will also compound. So these are just highlighting some of the areas where we need to focus on what the law says about these specific things. Beyond use data and documentation, quality assurance programs, right? So when we think of compounding, we think about operational survival. What are all the things that we have to put in place to practice or ensure that the compounded medication is safely produced, and the environment that we practice in does not introduce bacteria and other things, right? Contaminants. All right, so we look at mail order and central filling. There's been it's a lot of central fills, especially now that we have a lot of telehealth going on. Here, legal complexities center around out-of-state patient laws, because as a mail order pharmacy or central fill pharmacy, if you are going to ship across 48 states, 50 states, then you need to understand each state's laws and regulations. Above that, you also need to understand temperature control compliances for each state. America is huge, and the temperature fluctuates from east to west, right? So it's very important to understand while it's winter and it's 20 degrees here in, let's say, New York, I'm shipping from Texas and here is 80 degrees. So how does the package how can I put this package so that it arrives in New York in a temperature controlled envelope, right? So I can still say that medication is safe for use. Those are some of the things that you have to know when you work in a mail order pharmacy. Delivery documentation, control substance shipment rules, and then verification and pharmacist oversight. What's the scope there? So for practical competencies that we're going to focus on, and it's not verbatim with what we have in ABP, but by the time we cover everything, we will be kind of in sync with the 4 competencies that we have within ABP. So first is patient care, full scope of patient care, and we'll go into that later. Professional practice, legal compliance, and ethics, right? So with patient care, we're looking at, is a prescription valid? We're looking at emergency refills, partial fills, immunization authorization, documentation requirements, collaborative practice, right? It's really what you're legally allowed to do for the patient. That's the umbrella that we're going to use to present it here. And it's important to know that sometimes there are things that you can do, right? But you shouldn't be doing. So sometimes helping becomes unlawful. And so it's important to know the limits of what you can do, your scope of practice. Professional practice really includes looking at pharmacist scope and authority, technician supervision requirements, ratio limits, intern delegation in terms of what can an intern do for you, or what is their scope of practice as well as interns, remote verification, and telepharmacy rules, right? So this affects workflow in every shift. Looking at legal compliance, we're really looking at the operations, the record retention, inventory documentation. If something is lost or stolen, how do we report that? PMP requirements, control substance security, meaning do we put our C2s, C3, C4, C5 all across the inventory? Or do we put our C2s in the safe, right? And what, of course, is a C2 in our state, Texas? And then, of course, in every practice, you need to ensure that your facility is inspection ready. There's nothing worse than preparing for an accreditation or preparing for an inspection that you know of, and you're spending 3, 4, 5 weeks trying to prepare for it. Nothing beats that stress when you also have to focus on patient care, patient safety. So being proactively ready is key in practice. Looking at ethics, we're looking at corresponding responsibility, and that comes up many times. If we're prescribing, let's say, protocols that cover antibiotics, immunization, it's important to also understand that many times in practice, you may be faced with a prescription that you're not really in agreement with. And for most part, when you call the prescriber, they will listen and you will arrive at a good, you have the issue resolved, right? But there are those edge cases, those, I call it the 1%, when someone will tell you, I wrote that, dispense that, right? It's important to understand your responsibility when it comes to dispensing medications and patient safety. What will you be held accountable for? And with that information, you can then communicate effectively that I understand you wrote it. However, this is what I can do here. And because I don't agree with it and I am also liable, we have to arrive at a different solution. It's not dispense because I wrote it. It's going to be, I need to document why I think it's this way, but you insist on it being this way. We'll get into that later. So with that said, when can you refuse to fill something, right? When it's not legal to dispense. Fraud prevention, how can you as a pharmacist help with fraud prevention? That is a training that we take often, and we're going to talk more about that. Red flag identification, conflict of interest, and patient confidentiality, other things that are covered under ethics. So just because something is technically possible doesn't mean that is legally defensible, right? When we're talking about Texas pharmacy law, we will be weaving in some federal acts and rules and regulations to keep in mind in order to practice wholesomely. So we can't just study Texas law and go take the MPJE, right? We need to understand both Texas law and federal law. All right, so let's take a look at some daily judgment calls that pharmacy law helps us prepare for, right? First one, and bear in mind, some will be obviously wrong, but again, the exam is testing how well you can function in real life situations. Can you practice independently in real life in the state of Texas? So, patient requests an early refill for a Schedule 2 prescription because they are traveling, right? You must, what are some of the things you think about? Is a partial fill allowed? Is early refill permitted? Is documentation required? Is PMP review mandatory? Are there any red flags? So these are some of the things that you take a look at, you think about. Now you're thinking about partial fills because maybe you don't have the full medication in stock, right? Or how early is this fill? And of course, are refills allowed on Schedule 2? That's one upfront question you're asking yourself, right? You ask yourself a lot of questions before you dispense a medication. So many times these things present themselves and you're not thinking, this has to do with law. You're just thinking, I need to get this prescription out of here, but you're really practicing pharmacy law. All right, so now another scenario is a prescriber calls in a verbal order for a non-controlled substance, right? They're calling in for that and the technician picks up the phone. Can the technician take that verbal order? What documentation is required, right? What must the pharmacist immediately verify that information? And what if the prescriber is out of state? It's from out of state. Then can they even prescribe what they're calling in for? So there's so many questions that we ask ourselves daily. And your knowledge on Texas law will let you know whether to halt the technician before they even start asking questions or what are the steps that you should take when a prescription is being called in by a physician or physician's office. Another scenario that just all these scenarios do right at this time is to just get you thinking, and we'll delve deeper as we continue this course. All right, next scenario, you discovered an inventory discrepancy for a controlled substance. Doesn't tell you which one. It's just you've just discovered one, right? Must it be reported? Who are you reporting it to? Within what time frame? What documentation protects you? Right? So this is a license protective knowledge. Once you understand pharmacy law, there's just so many scenarios where that information will save you, for lack of a better term, right? Actually, that is the right term. It will save you. So this exam tests, number one, your general knowledge. It tests you using scenario-based questions, multi-layered questions. Some questions are subtle. There's some consequence-focused questions, right? And it really tests your understanding of practice outcomes. What are the most important things? What are the things that you can do to ensure that you're practicing safely and ultimately helping and improving patient safety, right? Patient safety is the ultimate focus, and all the rules and regulations are really geared towards, all put in place for patient safety. License protection, employer protection is all a byproduct of the rules and regulation put in place for patient safety, right? So now it's important that you don't memorize unnecessary, unless you have to take it tomorrow, right? And you have missed studying, then you have to do whatever it takes. But if you have at least 2 weeks to prepare, no need to memorize. Understand the purpose of the law. Understand the risks of not executing according to law requires, right? And what are the consequences when you don't abide by the rules and regulations? This is how you practice and pass confidently when you take your pharmacy law exam. So this course will break down Texas law into practical modules. We'll provide scenario-based questions that we'll actually answer this time, and we'll focus on real-world applications. We'll highlight common exam traps, we'll identify high-risk misunderstanding areas, and we'll compare similar but legally distinct concepts. So after 2 weeks, we'll be ready to take that MPJE. This course will not be for those who like passive learning, right? This course will be exam focused, it will be practice protective, and it would be almost like defensive driving, preparing you proactively to protect your license, right? So if this is something you're interested in, you know someone who's gonna need to take Texas Pharmacy Law upon graduation, thinking to reciprocate into Texas, then share with them, subscribe to this channel, and I will see you with the next lesson. Take care.